Hello and welcome to Salud, Here's to Your Health, presented by Jackson County Library Services and La Clinica. I'm Carrie Turney-Ross, Adult Services Coordinator, and I'm joined today by Justin Adams. He is the La Clinica Chief Medical Officer, and Anita Burke, who is the Communications Specialist. And Eric is here doing our ASL interpretation. In today's webinar, you will have the opportunity to ask questions, and the panelists will answer them after we've all had a chance to speak on our topics. Please enter your questions into the chat box, which is located at the bottom of the screen. This program is made possible by the National Institutes of Health and the National Library of Medicine. Developed resources reported in this program are supported by the National Library of Medicine and the National Institutes of Health with University of Washington. The content is solely the responsibility of the authors and does not necessarily represent the official views of the National Institutes of Health or Jackson County Library Services. Today, we will talk about COVID-19, reflections on the past year and where we stand with vaccinations and current cases, finding trustworthy health information using resources from JCLS and other reputable sites, talking to your doctor and what they need to know, and understanding your prescription and La Clinica's pharmacy. Everyone who is registered for this program can receive a medical log. This is a tool that will help you be your own best health advocate. If you have not received one yet, please email me at cturneyross@jcls.org. So now I will get started talking about COVID-19. Justin and Anita, if you'd like, you can turn off your cameras at this time. All right, so this is not news to anyone. We have been in a global pandemic for over a year now. Many Oregonians have lost their jobs, their sense of security, and loved ones as a result. According to the Oregon Health Authority, Oregon has had 167,128 confirmed or presumptive cases of COVID-19 and 2,394 deaths as a result of the disease. In Jackson County, there have been 14,045 positive tests and 123 deaths since March of 2020. COVID has disproportionately affected people of color. According to the Kaiser Family Foundation, African Americans make up 2% of the Oregon population, but account for 3% of all COVID cases. Those in the Latinx community make up 13% of Oregon's population. However, they account for 34% of all cases. This is due to a lot of reasons, they're varied reasons, but the information is still the same and it has disproportionately affected that community. But there is good news. As of Monday, 771,752 people in Oregon have been fully vaccinated. Another 497,299 people are partially vaccinated. This means that more than 1.2 million Oregonians are fully or partially vaccinated at this time. People who are currently eligible for the COVID vaccine include those who are in phases 1A and phase 1B groups 1 through 6. To find out if you are eligible, you can go to getvaccinated.oregon.gov and answer a series of questions. I will put this link into the chat after I've done speaking on this topic. You can also go to the Jackson County's public health website to get more information and find vaccine locations to make an appointment. Beginning April 19th, everyone over the age of 16 is eligible for the vaccine. Jackson County remains in the high risk category. This is due to high daily numbers of confirmed or presumptive cases. We must all continue to do our part by wearing a mask, limiting gatherings to small groups, and maintaining a distance of 6 feet from people who are not in our household. There are other ways to do our part. I'm going to share some information here on debunking COVID myths. So here are some of the myths that are out there about COVID-19, and these are the facts about them. Vaccines against pneumonia and the flu do not protect against COVID. You need to get the COVID vaccine to be protected. Saline wash. There is no evidence that rinsing your nose with saline protects against infection. Exposure to the sun or to temperatures higher than 77 degrees does not prevent COVID-19. You can still get COVID in a sunny, hot, or humid day. Taking a hot bath also does not prevent catching COVID. On the other side of that, cold weather and snow do not kill COVID. Spraying alcohol or chlorine on your body won't kill the virus if it has entered your body, and these substances can be harmful to you. Drinking alcohol also does not protect you from COVID-19. There is no evidence that eating garlic protects against infection of COVID-19. Ultraviolet light can be used to disinfect surfaces, but do not use UV lamps to sterilize your hands or other areas of your body. This can cause skin irritation. This is the big one. 5G mobile networks. Avoiding exposure to or the use of a 5G network does not prevent the infection of COVID-19. Viruses cannot travel on radio waves or mobile networks. So what can you do to prevent COVID? Like I said, you can avoid close contact with anyone who is sick or has symptoms. Keep a distance between yourself and others. People can spread COVID even if they do not have symptoms. Wash your hands often with soap and water for at least 20 seconds. If you do not have access to soap and water, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Continue wearing face masks when you are in public or when you are outside and you cannot physically distance yourself from the crowd. Cover your mouth and nose when you need to cough or sneeze. Avoid touching your eyes, nose, and mouth. Avoid sharing dishes, glasses, or bedding or other household items if you are sick. Clean and disinfect high-touch surfaces daily, and stay home from work, school, or public areas if you are sick, unless you are going to get medical care. Avoid taking public transportation if you are sick as well. And now I'm going to share those links that I talked about really quickly. So I'm going to put this in the chat and you will all have access to it. This is that getvaccinated.oregon.gov. And this is that Jackson County Public Health page. All right. And now I'm going to talk to you a little bit about finding trustworthy health information resources using your library. Okay, finding trustworthy health information with JCLS resources. Finding quality information can be hard, especially when it comes to your health. With the wealth of information that is available online, sifting through the junk can take hours. Then figuring out which information you can trust is even harder. When you've been diagnosed with an illness, you'll naturally want to find more information on the subject. But where do you start? How do you know what sites are giving quality information? While Google can sometimes be a great starting point, if you don't know exactly what you're looking for, you might find a lot of bad information and only end up scaring yourself. WebMD is another popular site for checking symptoms and illnesses. However, there are a lot of ads on every page, and some information may not be as helpful as you would expect. One thing you don't want to do is self-diagnose. Researching what might be causing a symptom is one thing, but you should always consult your healthcare professional. So let's take a quick look at Google. Let's say you've been diagnosed with type 2 diabetes. When you do a Google search, you'll notice you get nearly 300 million results. The first few are almost always ads, so you really do want to avoid those. You see that some of the sites that come up, they might provide quality information, but again, how do you know? So then we're going to look at WebMD, which shows up in the Google search. Again, you're going to see a lot of ads. You'll notice that it says there are articles here, but we don't know where those articles come from. You have to do a lot of scrolling, and advertisements pop up all throughout the page, making it difficult to know what is the information you actually need to take from this site. But don't worry, JCLS can help. We have books on a wide range of health information topics, and we also provide access to trustworthy and accurate databases and websites. The information you find in these resources has been verified and reviewed by professionals. You'll never have to ask yourself, is this an ad, or is this information that I truly need? So in our research databases, we have one section specifically called Health and Lifestyle. Hold on. Attendees, can you tell me, are you seeing Eric in the top corner? Can you just type in the chat yes or no? No, you can't. Okay. Can you see him now? Okay. Great. So our research databases. You can find a page on our website called Health and Lifestyle under Research. Our resources, the library resources, are databases that are paid for by JCLS or the Oregon State Library. These databases provide peer-reviewed articles and reference resources. The additional health resources are a comprehensive list of websites that are provided by the National Library of Medicine, National Institutes of Health, Centers for Disease Control, and more. These are authoritative resources that are trustworthy, and most of them are designed with the consumer in mind. So this information is for patients like you. So to get to that page, you can access it by going to Research, Health and Lifestyle. On this page, you'll see our Dewey Decimal numbers. Any books on these topics would fall more than likely in those number categories. There's also resources from the library and Jackson County Public Health, as well as those databases I was just talking about. Now, some of the databases are designed for healthcare professionals and students, but there's also information that is useful to everyday consumers like yourself. And then here are those additional health resources. So we're going to very quickly look at Gale Health and Wellness. That's one of the library's databases. So again, showing you how to get there. And you'll see this Gale Health and Wellness. When you first open the page, you'll see that there are topics of interest. These change frequently. You can also browse topics in a few different ways. Down here at the bottom, they have some suggestions. They might be new resources, newly updated, or topics that are popular with those who use the Gale database. When you click on Browse Topics at the top, it gives you all of the topics, but you can select new or updated, diseases and conditions, drugs, mental health, and narrow it down that way. Or if you know what you're looking for, you can search it or you can scroll to find it. So let's go with diabetes. Now there's an overview on the subject. It tells you all of the resources that are available and what they come from. So you'll notice there's reference, magazines, news stories, videos, and more. This resource can be very helpful, but like I said, it is designed with professionals in the healthcare industry in mind and might be difficult to navigate, but you can always get help from library staff to find the information that you really need. The quickest and easiest website for consumer health information is Medline Plus. So we'll click here on Medline. And you see there's not a lot of scrolling on this first page. You can find health topics, drug and supplement information. If you're looking for things about genetics or medical tests, there's medical encyclopedias and even healthy resources. And this page is available in Spanish. Not all of the pages are going to be in Spanish, but quite a lot of them are available in multiple languages. So again, let's go to health topics and look at diabetes. There's a lot of topics that are related to this, but let's say you've been diagnosed with type 2 diabetes. On this page, you're going to find all of this information. There's a very helpful summary. There's health check tools, more information about living with or related issues, and also the diagnostic tests that you might have to go through, prevention and risk factors. The summary gives you a very basic introduction. I'm going to pause this real quick. So I want you to notice this easy to read. That tells you that this is something that consumers are definitely going to be able to understand. Patients like yourself will understand it. A lot of these others are also meant for consumers. However, this one tells you that the information is drilled down in a way that makes it easy for you to understand what it is talking about. So if we go to this start here, what is diabetes? Again, it gives you detailed information about what to expect in this article, tells you about the different types of diabetes, and this is provided by the National, the National Institute of Diabetes and Digestive and Kidney Diseases. So going back to the Medline Plus page, you can also look closer at symptoms, those diagnosis and tests that I previously mentioned. prevention, risk factors, treatments and therapies, and a lot of information that it's really up to you. What do you want to read? How far do you want to go in learning on this resource? We've got this 4 steps to manage diabetes. And again, it has information that will help you in navigating your life with this, with diabetes, as well as options for better ways to keep records of your medical care, your tests, your blood pressure, cholesterol, what you talk about with your doctor at each visit. And these are tools that are available to anyone, and they are completely free. Another thing I want to talk to you about is these videos and tools. So you'll notice you can view health videos, health check tools. Oh, so here on the health video, there are a lot of different topics. These might pop up when you're on the specific health topic page, but let's look at vaccines. You can see here, gives you a cute little video and an overview of what is expected in that video. Also related health topics. The health check tools, these might help you figure out, do you need to get a hearing test? There's a pet allergy quiz. I thought that was fun. You can take this quiz to test your knowledge about myths associated with pet allergies. You know, if something comes up, I'm going to pause this. If something comes up and you want to find out more information and quiz yourself as you're learning, there are a lot of these great tools available in Medline Plus. Here we have the Understanding Medical Words tutorial. So maybe you want to find out why you and your doctor are speaking different languages. By going through this tutorial, you're going to learn more about medical words. This one is really important, and unfortunately, it's not available in Spanish. It's only available in English at this time, but you can take this tutorial to become better on evaluating internet health information. Let's say you find a resource online and you're not sure if you can trust it or not. A tutorial like this will help you know whether or not you can trust the information you're reading. There's this checklist that you can download and keep by your computer when you're looking at health information. So these are the things that you really need to ask yourself when you're evaluating a website. Who is in charge of the site and why are they providing it? And can you contact them? Some sites won't have a way to contact the provider, and that is a big red flag. You also want to look at funding. Where does the money come from? Are there advertisements, and are they clearly labeled? That is very important. Sometimes sites will have advertisements to health products, and it doesn't tell you that it's an ad. It makes it seem like it's legitimate news and not that it's trying to sell you something. The quality of the information. Again, where does the information come from? How is the content selected? And do experts have any involvement in reviewing it? Finally, privacy. Will this site ask you for personal information? And do they tell you how it will be used if they do ask for it? These are all important things to keep in mind when you are looking at information on the web. And you can even use this tool when looking at Medline Plus or any of the resources we've provided to see what a good example of an internet health resource is. So if you want to find information, you maybe don't want a website, you want a book, you can find that when you go to jcls.org and go to our catalog search. So again, keeping with this theme of diabetes, you can type in the topic in this keyword search, and it will tell you all of the resources we have in our collection on this topic. So you'll see 168 results here, and these include books, videos from Canopy, which is one of our streaming video services, and more detailed books for adults. You can limit or filter what shows up. Let's say you just want books and you want to make sure that they are intended for adult audiences, so for grown-ups. And you'll see you get 126 results here. You might be looking for a book about mastering your diabetes. That's right there. Reversing. And there are also really great cookbooks that are specifically made for a diabetic diet. So see this American Diabetes Association and Real Food. So there's a lot of options depending on what it is you're looking for. You can just place a hold on any of these titles and pick it up at your favorite library. So that concludes our brief tutorial on using library resources to find trustworthy health information. But remember, you are not alone in this. We are here to help. If you have questions and you want to call the library, you can call the Medford or Ashland Reference Desk to talk to a librarian. You can also stop by your favorite library branch, and any JCLS staff member can help you locate books or relevant databases to find trustworthy health information, or information on any topic for that matter. For a full list of open hours, you can go to jcls.org/hours_locations. All right, and now I will hand it over to Justin. Let me turn on my camera. I will hand it over to Justin Adams so that he can talk to you about talking to your doctor and what your doctor needs to know. Welcome, Justin.
Thanks, Carrie. And thank you for the introduction. My name is Justin Adams, and I'm a family physician and also the Chief Medical Officer for La Clinica. And I'm happy to talk to you guys a little bit today about how to prepare for a visit with your medical provider. What I'd like to share is a brief presentation put together by the NIH on this topic. So let's see if I can screen share here. Oh, Carrie, I think you have to give me permission to share my screen. I'll try again.
Okay, let me do that. I'm going to make you a co-host, and that will give you permission to share your screen.
Great, thanks, Carrie. Okay. All right. I see the interpreter still highlighted, so I'm hoping that all of you can still see her. Please throw up in the chat if you can't, and Carrie can help with that. So the topic of this talk is talking with your doctor. So a lot of this is about preparation, right? You get into an office visit with me and I have patients scheduled every 15 to 20 minutes. And just the experience of being in there and checking in at the front desk and getting your vital signs checked and move back to a room. And then you can see that I'm rushing in from my last patient. It's intimidating. And when that intimidation happens, what we came in to talk about sometimes gets lost out of mind. And so this talk is going to help you a little bit in thinking about how to prepare for that visit. So the first thing to remember is that you are an official partner in your healthcare team. There is virtually nothing that I can do as a provider without your help. And so as an official active partner, make sure that during your visit, you will actually be expected to ask questions, speak up, and stop me in my hurrying when you need to. Now, this can be easier said than done, right? So you can think of your doctor's visit as like game time or like race day. And you got to train, you got to prepare for game time or race day. Um, so we won't do these activities together because of the Zoom format. But you think about something like listing what you did yesterday and having to do what you ate yesterday and having to do it on the spur of the moment. It's challenging, right? And so when we ask you questions like, what are all of your medical conditions? What are all the medicines you're taking? What kind of treatment have you had for that? Who is your last provider? All of those things in rapid fire order, it can be really difficult to keep up. So getting ready for your appointment. So some of the things you can do is to actually plan for your visit. So my patients that come in who have a checked list like this, I think it's a great way to start. Now, do know when you're going in to see your doctor that your doctor has your visit scheduled and everybody else, but coming in with a checklist sometimes allows you to do priority setting with your doctor, and deciding whether your priorities for that day, coupled with your provider's priorities for taking good care of you, will fit into one visit or whether you should be planning multiple visits to have all of your needs met. Um, Now, other things that you can do to get ready for the visit, and the books that Carrie shared at the beginning, that the library can provide for you, I've looked through those myself, and they are a great way to get organized for the visit. So the book will include things like where you can write down your other doctors, including past doctors or past medical providers, insurance cards, your medical history, and your medicines that you're taking. And if you have all those in a book ready to go, then you don't have to worry about remembering them all when you come in to see me. Next thing about getting ready for an appointment, think about what you'll need to see, hear, and communicate during your visit. So making sure basic things are in place. You've got your glasses ready to go. You've got your hearing aids ready to go if you're using them. Bringing a family member or friend who's familiar with your medical situation. Um, and then asking your doctor for an interpreter if you need one, or bringing your own interpreter with you if you have one. So then setting your plan into action, so sharing your information with the doctor during the visit. We're going to skip this activity again because of the Zoom format. So doctors and other medical providers, when we go through training, we are trained to think about medical conditions in a very set and formulaic way. We try to think about things in a step by step by step way so that we don't get distracted and so that our work is really consistent. Now, we are trained that even if you don't present your medical condition in a way that matches our training, we do work to organize it as you explain it to us. That said, when you can come into your visit and your way of explaining what's going on in your body matches the way that we've been trained to think about it, it just really streamlines the process and gives you and the provider more time to think about what's going on. So some of the things that we're trained about when we go through medical school are, what are your symptoms? When did those symptoms start? Do you have your symptoms all the time? Or do your symptoms come and go? And if so, is there any pattern to the coming and the going? What makes your symptoms better or worse? Now, this may include medications that you're taking, but it may not be limited to medications that you're taking, right? So for example, if I have back pain and my doctor asks me, what makes your back pain better? I might say ibuprofen. I might also say sitting down. I might also say it feels really nice when my wife rubs my back, right? So it doesn't have to be limited to medical treatments. Um, and then the other thing to really keep in mind is how these symptoms are affecting your daily life. So it's a really different thing if I say, my back pain keeps me from being able to do everything, right? I can't work in the kitchen. I can't play with my kids. I can't go to work anymore. Versus, it bugs me sometimes, but it's really not a big deal. So sharing information with your doctor. So making sure that your doctor has a good background to be able to think about your specific problems in. So make sure that your doctor knows your medications. Make sure your doctor knows about your lifestyle habits. So that might include things like sleep, recreational drugs, alcohol, um, all different things. And then what other concerns you have that tie in with your back pain, right? So for example, or whatever condition you're presenting for. So for example, if I have back pain and it's been going on for so long and limiting my life so much that I think I'm also suffering from depression, I want to make sure to help my provider to be able to tie those things together. Um, so this is just an example of a common doctor patient communication. It's a dialogue, right? So it should start with you sharing your health concerns, followed by your doctor asking questions about your symptoms, you answering the questions, your doctor then sharing thoughts on diagnosis and treatment. And this is the part that's often left out, you asking questions to better understand the plan. Now, and this isn't part of this presentation, but in my opinion, one of the most important questions that you could ask, especially if your sense is that this is not a cut and dry diagnosis with a single treatment, one of the best questions that you can have in your mind when you're going to see a doctor is, what else could it be? If it's not this, what else could it be? Now, most of the time when we like to think that we're practicing medicine in a black and white world. The reality is that we practice in a world of grays. And what your doctor is doing most of the time is they are giving you their best guess based on what they've been presented for what's going on for you and their best guess about what might help you. When I work with medical students from OHSU, when I work with nurse practitioner students, when I work with new providers, one of the most important things that I tell them that they can do as providers is to communicate with their patients the idea of diagnostic uncertainty, right? Which is to tell your patient, this is what I think and this is why I think it. And I might be wrong. And sometimes to even say, here are the ways that you will know that I'm wrong, right? If you take this medication and your pain doesn't get better, your pain might be caused by something else. If you take this medication and your shortness of breath doesn't get better, your shortness of breath might not be due to asthma, for example. Okay. And then finally, your doctor will have a chance to answer the questions that you are asking about your diagnosis and treatment. And that way, actually, they know that you're going to have a better chance of engaging with what they recommend. Here's some examples of some tests or questions that you can ask about medical tests. So what would the test tell us? What does the test involve? How should I get ready for the test, right? Some tests might require you to fast, or if you're doing a colonoscopy, you might have to do a bowel prep or something like that. And then, are there any dangers or side effects of the test? Here's some questions that you can ask about your diagnosis. What may have caused this condition? How long will it last? Is it permanent? How is this condition treated or managed? And how will it affect me? And this is really helpful for doctors, and we're trained to ask you to do this, but not everybody does because life gets busy. When the patient can repeat back to us what they understand in their own words, it really helps us to understand that they understand us and that we're going forward together. Here are some good questions to ask about treatment options. So what are my treatment choices? what are the risks and the benefits, and then asking yourself which treatments are best for me given my values and circumstances, right? I always tell my patients at the end of the day, you live in your body and you choose. I'm not going to follow you home, right? I won't know whether or not you're going to take my prescribed treatment. And I would rather understand from you whether you are aligned with this treatment or not. You know, if you nod and you leave and then you think my advice was bad advice and I don't know, then I won't know what to do next. And then here's some closing thoughts about ways to maintain a doctor-patient partnership. So prepare for your appointments by writing down a list of your concerns. Share any changes in your medical history and a complete list of your medicines. Make sure that you understand what the doctor is telling you, and please let us know if you don't. And then take notes or ask the doctor to write down information to help you remember. Now, most of us are on the same electronic medical record now. Some people have others, but every medical record has the opportunity for your doctor to print out an after visit summary for you. And in that, there's a free text box for us to write down or explain anything that you think you might forget. And then again, this came from the NIH and the NIA, and they're a great resource for this kind of information. Back to you, Carrie. I will silence myself. Stop sharing.
Thank you so much, Justin. We really appreciate that. And that is really great information for all of us to know. So now I will hand it over to Anita Burke so that she can talk about your prescriptions and the La Clinica pharmacy.
Thanks, Carrie. Our director of pharmacy was going to be here, but she didn't have a good internet connection, so I'm filling in as a substitute. And I don't have as much knowledge as she does, but that's what I'm here to talk about, is just how much information your pharmacy team does have. They're really a key part of your medical care team. You might not think about that as much, especially if you get your prescriptions from like a large chain, but La Clinica has community pharmacies that are right in our health centers. So it really probably might feel a little bit more like part of your care, your regular doctor's appointments, but any pharmacist at any location is going to be able to be a consultant and a partner with your health. And it's really handy because, like you said, Justin kind of closed up with that list of questions that you might have when you finish with your doctor. But if you're like me, sometimes you walk away from something and it's kind of going around in your brain, but you have some more questions later. So if you have a prescription to pick up, remember that your pharmacist is another great way to get a little bit more information. When you pick up that prescription, you can go ahead and ask them a little bit. Remind me, what's the name of this prescription? How do you pronounce that? What is it for again? And how should I use it? They can give you great tips, reminders about how to store it safely, and whether you take it in the morning, what do you take it with food? Do you take it at night? Things like that. They can sort of walk you right through that. They can tell you if you have side effects, what some effects you might want to look out for. If there are things that this medicine might interact with, food or alcohol or things like that, they will be able to provide that information with you. La Clinica's community pharmacies are really a nice way to do that. That's why La Clinica did open our two pharmacies that we have. We have one at our wellness center and one at our Phoenix Health Center, which is on South Pacific. And they've been open just about a year. They're open to everyone in the community. Anyone can come and get their prescription filled there. what you need to do to get involved in that is the same thing you would do at any pharmacy. To have your prescription information, your doctor can send it in, and then for refills and things like that, you will have that information that will be available for you in a handy way, your prescription number and things like that. They can also help with like the log that Carrie mentioned, sorry, and Justin, about having that list of all of your prescriptions, your over-the-counter medication, any, like if you take herbal supplements, if you take vitamins, having that list to share that with your pharmacist is also really quite useful. Because they can, again, know those interactions and make sure everything is working the way it is supposed to in a safe manner. Another feature that the La Clinica pharmacies have is we have some new kiosks for safe disposal of medication, because hopefully you're going to take all of your medication exactly as you were told by your doctor and reminded by your pharmacist, but sometimes it doesn't work out, so you have some leftover medication, or sometimes people even don't follow all of those instructions and have medications that they don't take. And our kiosks at our pharmacies are a safe way to dispose of those, because having old medication in your home can be a bit of a household hazard. You don't want kids or pets or just anyone hasn't been prescribed that medication to be able to have access to it. So these kiosks are a place you can drop it off and it will be safely disposed of. That keeps it out of the landfills, out of our water sources, things like that as well. So it's good for the environment, it's good for you and your household, and it's, again, really handy. You can drop it off right at our pharmacies located in our health centers. And I didn't have nearly as long a presentation as the other speakers did, but I think that sort of wraps up some of the basic points I wanted to hit. If there are questions, I'm sure I will do my best to get answers for those, as well as with the other panelists. So thank you all for attending.
Thank you so much, Anita. That was very helpful information, and I didn't realize that everybody could use La Clinica pharmacy. So that's really good news. So now we can go ahead and start the Q&A session. If you have questions for any of the speakers, we will answer them to the best of our ability. If we can't get an answer for you right now, if you want to give us your email address, we can send those answers to you after we've gotten them. So here in the chat, I just want to, here, let me see. And Anita and Justin, if you want to turn on your cameras so that people can see us while we're answering questions, if they type those into the chat, we'll all be here visible for them. So in the chat, there was a question. I don't know if everyone else could see it, but one person asked, does the doctor check to make sure all the medications a patient is taking are compatible with each other? Or is this something the patient should ask about? And Justin, do you want to answer that out loud so that everyone can hear the answer?
Sure. This is Dr. Delilah. She's joined us today as well, and she's whispering the answers in my ear. So yeah, thank you to Megan for that question. And so what I said is that your physician will generally review your drug-drug interactions and many of the electronic medical records that we use will actually alert us if, for example, I enter in a new medication that interacts with something that you're taking. But that said, it's never wrong to ask, especially when you're being prescribed a new medication. And then the other thing that I said along this line was that if you are taking any over-the-counter supplements or over-the-counter medications, make sure that your doctor knows about those too, because they may also interact with medications that you're taking.
Thank you. So I have a question, Justin. Is there such a thing as too much information?
You know, so there is such thing as your doctor having limited time, right? So that's the reality. And so, you know, if you think about my talk, a lot of the things that we had in there were about organizing your time with your doctor so that you can use it most efficiently, right? Because there is a point at which your provider's next patient is going to be sitting across the hall waiting, waiting for your doctor to see them. Now, if you think about the balance, I bet most of us, so doctors come in two types. There are the very efficient types who sometimes feel like they will be hurrying you along, and there are the ones that will sit there with you for an hour. And they both have their advantages, right? So the one that will hurry you along, you might feel a little bit rushed, you might feel a little bit pressured, but my guess is that you won't spend 2 hours in the waiting room waiting for them. And so, you know, what we're always thinking about at La Clinica, and what I think about as a leader of medical providers at La Clinica, is what are the things that we can do with our systems to make your visit really efficient, right? So that that 20 minutes feels really connected, you feel really heard, and you haven't had to spend 2 hours waiting for me in my waiting room, right? I want to try to create a healthcare setting where you are seen on time and I'm respecting your time, and where you get your needs met and you feel really connected during that visit. And so, you know, that's what we're working on. That's the holy grail. And I think these things that you do to prepare for the visit will help build to that as well.
And now another question that I have. So part of my job is making sure that people have access to quality health information. And I wonder, is it better for them to do the research before or after their appointment? If they have a symptom, would you prefer that they do some research on their own or wait until after they've spoken to you to start that research?
I mean, I think when somebody's sick or hurt, the idea, I mean, I have a high opinion of myself, but the idea that somebody would not be curious, would not look beforehand, I think would be a silly expectation. You know, in general, I'll speak for myself, which does not necessarily mean speaking for all providers. I kind of like it when my patients have looked things up beforehand. And especially if they have looked things up beforehand, I really appreciate it when they tell me what they've read already, because it gives us a better starting place for the conversation. I really appreciate your talk and sharing some good resources for patients, because there are a lot of rabbit holes to go down on the internet when it comes to medical stuff. And spending our precious 20 minutes helping somebody to dig out of the rabbit hole that the internet has dug them into is often not the best use of either one of our times. I'm married to a teacher, and so we have a doctor and a teacher in the same household. And we spend a lot of time thinking about this notion in our modern world of how do we know what's true? What makes a reliable resource? And so this giving people good places to start from when they're starting to do their own research, I just really appreciate that that's the place we started from. So thank you.
Thank you. So we've got, we'd scheduled this program to last until 7:30, but that doesn't mean we have to hang out here until 7:30. But I do want to give you all of you attendees, the opportunity to ask any questions. So if you want to put something in the chat, we'll hang out here just a little bit longer and try to answer those questions to the best of our ability. While we wait for you to possibly put in a question, I'm going to point out this medical log again. If you haven't received yours yet, again, you can email me, and I'm going to type my email into the chat. All right, and so you can copy and paste that and make sure you contact me to get your medical log. I'm going to just kind of show you some of the stuff that's in here. So first, it's going to ask for, your basic contact information. And then it clearly tells you all of the contents. I don't know if you can read that very well here. Doesn't quite translate to screen well. But what I found really helpful is there's a place for you to enter your medical insurance information. So if you change insurance companies, there's plenty of space to put more insurance companies there. You can also put the name and address and phone number of your pharmacy, any of your professionals that are involved in your healthcare, so your doctors, nurse practitioners, alternative health practitioners. There's also family history. This part is always hardest for me when I'm filling something out, because I've got a big family with a lot of medical background, a lot of medical history, and trying to remember, okay, who had the cholesterol problems? Was it on this side or this side? So filling this out, I'm actually planning on doing that tonight when I get home. And then your own medical history. So there's a lot of ways for you to track who you are in, what groups you're involved with, what doctors, clinics, and all of that. And so this is a very great tool. I was very happy to find this and make it available to all of you. So it looks like we've got some questions coming in the chat now. How consistent, oh, we'll wait just a second. Okay. All right. How consistent are lab results from one lab to another, such as an A1C?
Anita, do you want to take that one? No, I'm just kidding. So it depends a bit lab to lab. And then, of course, there are labs that vary depending on time of day, weeks of the year. And so I'm going to put that caveat on my answer. If you're doing the same lab at the same time, two different labs drawn, they're generally going to be close. I'd say within about a 4% error is roughly it. So, for example, since the A1C was asked specifically, we do have two different ways to check A1C. One is through a finger stick A1C, and one is through a venous sample that's part of a blood draw. Those can vary, and so the A1C range is generally somewhere between about 4.9 and 16, depending on the particular tool you're using. You might have variation between those two labs of 0.2 to 0.4. So they're pretty close. And certainly as far as the meaning that we draw from that A1C, which is a test for diabetes, they're close enough for us to be able to make our decision making. Now, if you had two lab draws done at the same time, so that venous blood sample, and it was sent to the lab for two A1Cs, you would probably be within 0.1 of one another. So most of the time, same lab drawn in the same way at the same time, they're going to be quite consistent. Should I just go on to the next question too, Carrie?
Sure. So I can read it out for you. Are there reliable, easy, and affordable COVID tests? I've heard differing views.
Yeah, so there's a variety of tests that we use for COVID. The very most reliable test is a technology that we've had for a while, which is called PCR, where they get a sample. And what the test does is it looks for bits of viral RNA and it amplifies them so that the lab can detect them. It is a very sensitive test and it's very specific. If you don't have viral RNA, it will not amplify it. And so you'll get a negative result. If you have even very small amounts of viral RNA, you will get a positive result. So that's the most sensitive and most specific test that we have. Now, there are some minuses to it. Those are not the kind of tests that can be done in my clinic, for example. It has to generally be sent away and you get the value in, say, 2 to 3 days. And so the disadvantage of that is you might not, let's say you're infected with COVID, you might not know for a few days and you might have exposed other people in the interim, even though, of course, as your provider, I'm going to tell you, until you get this test back, behave as if you have COVID. But it's really hard to behave as if you have COVID until you know that you have COVID. The other disadvantage of that test, because it's so sensitive, even after you may have cleared COVID, so you might have heard what I will tell my patients is you cannot test out of COVID, right? Because you may continue to have little fragments of viral RNA in your nose for months after you are no longer infectious. And so that's why we can't use these tests to test out of it. We do have point of care tests for COVID. They're often a bit more affordable than the send out test because there's a lot less equipment involved in them. And they are generally quite sensitive and specific, meaning that a no means a no and a yes means a yes, where you can get a result in a matter of minutes. They are not quite as good as PCR, but they have the advantage of being fast, and they're generally quite sensitive and specific. Now, there are more tests coming out every week. I heard about a home test that's supposed to be quite accurate, where you get results quickly, and it's going to cost about $5. And I think that's out in Europe at this point, but not yet out for purchase in the United States. So I'm hoping that we're going to see more and more of these good point of care tests as time moves forward. You know, I'd love to see a situation where especially anybody who hasn't been vaccinated is able to test themselves anywhere from a couple of times a week to every single day before they go out in the world, and then they can be really confident that they're not going to spread the virus.
Thank you. So another question here, what apps can you recommend that are similar to the hard copy medical log, and do those kinds of apps protect privacy? I can tell you that on June 7th, so that's still a little ways away, but on June 7th, we are going to have a program here at the library, well, here on Zoom, hosted by the library, that is called Healthful Apps for iPhone. So one of our tech services staff members will be talking about some apps that are particularly good, especially if you're on an iPhone. And I can tell you, I use MyFitnessPal and I like it. Anita or Justin, do you have any other recommendations?
Gosh, Carrie, I wish I did have something specific that might serve the same purpose as that medical log. I'm sure they are out there. I have not explored them myself. And then I thought the follow-up question that Megan asked on there was really a really good one while people are doing their own searching, which is, do they protect privacy? And so normally the way that an app developer would be able to share that information is by saying that they are HIPAA compliant, which is the Health Information Privacy Act.
Great, thank you. Do we have any more questions from the audience? While you think about it, I'm going to share my screen one more time. So are you all seeing this Healthful Apps for iPhone? Okay, so I'm going to go to our event calendar. Just a second. Okay. And I want to show you some more upcoming programs that we have here at the library. So our theme for the spring is health and wellness. So a lot of our programs are dealing with health and being your own health advocate. That also includes getting outside and getting active. You can go to any of the JCLS branches and pick up a Get Up and Go bingo card. These cards, here, I'll share what it looks like. And it has some suggestions for places for you to go and get outside and enjoy beautiful Southern Oregon. If you get 5 in a row in any direction, you get you get a sticker that looks like this that will look really great on your water bottle or car, wherever you like to put your stickers. So now let me go back. There's another program that I really want to encourage people to attend. Let me find it on here. If you know any Spanish-speaking individuals who would also benefit from this program, we are doing a similar program to the one from tonight on Thursday. So please share that with your Spanish-speaking friends if you get the opportunity. And here, I'm just going to search the event that I want to show you. So Money Matters. This program is teaching people about budgeting, credit, debt, retirement, and fraud prevention. If you were affected by the wildfires or perhaps lost your job as a result of COVID, fraud is rampant right now, and this program is going to give you some tools on how to have a healthier budget and avoid fraud. This program will be available in Spanish as well as English. So please register for it if that sounds like something you would like to attend. So I will stop sharing now. It looks like we might have another question. How does La Clinica handle referrals to specialists if needed?
So we have a referrals team at La Clinica. And so what happens when I place a referral, it goes into the electronic medical record, which is then monitored by the referrals team. And the first thing they'll do generally is get that approved by your insurance. And once they have the insurance approval, then they will send that to the specialty provider's office. It gets faxed over, and then the specialty provider's office calls you to schedule.
Fantastic. All right, I'll give you just one more minute to type in a question if you have any last minute thoughts or something that's just been really on your mind and you haven't had an opportunity to ask it yet. Now is your chance. How do drive-in clinics work for COVID vaccine?
So the La Clinica does have a drive-in clinic for the COVID vaccine. And so qualifying patients, which will be everybody over the age of 16, starting on April 19th, they would just call to schedule their appointment and get registered. And then we have it set up as a drive-through. So you come in, you drive into the parking lot, you check your registration, you drive up, and they give you the vaccine, and then you sit in your car to wait for the 15 minutes. We do have nurses and medical providers on site. So if you're having a problem, you honk your horn, and someone will come over and see you. we are mostly at La Clinica serving our patients and then special at-risk populations. So you, Carrie, at the beginning mentioned how COVID is disproportionately affecting the BIPOC and Latinx population. And so we've had a special interest in vaccinating them. Migrant seasonal farm workers are special focus for us as well, as is the homeless community. And so we sort of, at La Clinica, we consider those folks to be our patients, whether they have registered with us yet or not.
Great, thank you. And just let me say, thank you to both of you, Anita and Justin, for participating in this program today and for the work that you do at La Clinica. I've had the opportunity to meet with multiple people who work in La Clinica through just different aspects of my job. And it really is inspiring that you all are out there helping everyone that you can, and people who are sometimes unable to get medical care through any other clinic. So thank you for all that you do.
Thanks, Carrie. It's a pleasure to be here. Jackson County Library is a wonderful resource for us. And so nice to be here tonight. Thanks for all of our attendees. Really great questions. And I hope they found this helpful.
Absolutely. Thank you, everyone. And we will go ahead and call this meeting, this program, a little bit early. So have a great evening and see you next time.